Good morning, everyone.
Hey, Tom. Good morning.
Morning, Tom.
Hi, Dave. Hi, Dave. Morning, Tom. This is Chuck. Can you hear me? I'm sorry, you were breaking up. Who's that?
Chuck Reinhold.
Hey, Chuck. You're coming in a little fuzzy, but I can hear you. For those of you that are muted, I sent you all a unmute pin in your email. You have to be logged in on the internet to get your pin off the screen. Otherwise, you'll be muted, which is fine.
Tom, Pat
Morning,
Shaw. How do you read?
Read loud and clear, Pat. Very good. Thank you. Morning, Richard.
Morning, Richard from DBI.
Matt Morrison, Maine Energy Marketing Association.
Hi, Matt. Good morning. Glad you could join us.
Thank you.
Hey, Tom.
Good morning.
Yeah, Pat.
I might have got you in trouble.
not my first time being in
Again? Again?
Yeah, right.
I told my wife that I was not available to do farm chores, especially forking manure, because you said I'm too essential for conference calls. And she would probably, you're not on her top 10 list at the moment.
Okay, very good. That's funny.
It's funny, we do a lot of that at DHS too.
Like shovel manure?
All day long.
I couldn't. That's funny.
You can't believe the requests that are coming in. It's unbelievable. You know, the good idea fairies, you know, of hey, you know, how can we automate email to, you know, assign RFI numbers or stuff like that to our system, and you're just like really? Okay, guys. Well, doesn't MS365 do all that with all the new tools?
Well, these unfortunately, these kinds of events force a lot of people to do what I should have probably done a while ago. Now I have to, and so it's kind of like a little.
Yeah.
Hey, Tom. We're hearing some feedback in the line.
Yeah.
Hey, good morning.
Yeah,
this is Chuck. Sorry, I think I fixed that feedback and the clarity of the call.
Chuck, you're loud and clear now. Yeah.
Hey, Tom, who is on?
Hey, Tony. Good morning.
Good morning.
Hey, Tom. Fred Ferrer's on.
Hi, Fred. Good morning.
Good morning.
Hi,
Tom, Jim Nowak's here.
Hi, Jim. Good morning. We changed the audio call in because all of the free conference call circuits are just not functional or reliable. So we moved to GoToWebinar, which is a paid service, but at least you know you can get through most of the time. So
Yes,
I'm watching.
having free.
I'm watching
having
the
issues
screen
with.
to make. Go ahead.
Yeah, gotcha. No, I'm sorry. I'm bleeding over you.
No, I'm watching the screen to make sure everybody's got their audio pins and have logged in to speak here. Matt Morrison, can you hear me? I just sent you an audio pin. You're coming up muted on my screen. Okay, Jeff Plackett.
I'm sorry, what'd you say?
You can hear me. Okay, you're coming on my screen. It shows you're muted. I just sent you an audio pin. Ignored it.
Yeah, I got you on screen. I got you on phone.
Okay, very good. Very good.
Hey, Tom, at some point, it'd be great if you could throw the screen to me just for a minute. I can show you some of the updates on FRWG.
Okay, stand by. All right. Yeah, we still got a few minutes. Go ahead, Dave. Why don't you? We got some new folks on the line, so let me explain what you're going to see. The electric sector started working a use case to support mutual assistance movement across the United States, and we partnered with Dave Jones. We've been using this dashboard for years, coordinating with fleet movement across state lines. So we use this as a way to centralize specific information. This disaster kind of caught us off guard, and that there's not an electric power outage issue, but we got a lot of the components in place, so we're quickly ramping up, as Dave's going to show you now, to bring in new information. But we use this as a way to coordinate multiple states and sectors on the same screen during events. So, Dave, I'll let you take it from there.
Okay, Tom, can you see the screen okay?
Yeah, we can see it, yes.
Okay. So what we've done over the last couple of weeks is ramped up FRWG to help respond with the transportation issues around the country. And so what you see is basically a purple map, which basically when the Federal Motor Carrier Services Administration issued their nationwide waiver for transportation, we didn't have the ability to do the entire nation at once. We could do states at a time. So we spent some time to develop the ability to add the entire U.S. For nationwide. And so when you go to this website, it's the web address, it's FRWG. You can see it right up here in the address, not lead, but the dashboard. This is the dashboard itself. So you can go to frwg.geocollaborate.com/dashboard. You'll see all these things that are up here. And so I'm going to navigate the dashboard here just for a second and show you that in the purple areas, you can access the actual FMCSA waiver for the national response. That's embedded in there, and also the National Emergency Proclamation from the White House. That's embedded in there as well. We also added some emergency declarations from Minnesota and Illinois, and I wanted to just during the call here, Tom, if we could just determine what states do you want us to post, to highlight on the map here, because like when you dive into Illinois, you can get their transportation permits and waivers that are official. What this does is it helps the truckers that are moving across the country to just click on this map and access the waivers as they pop up. So it really helps to inform everybody. The other things that you see on the map are weather advisories, like in Missouri, flood warnings, and all up and down the Mississippi, flood warnings. These are weather-related alerts and advisories. And then you see the blue here, which is the coronavirus counts by state. GeoCollaborate is consuming the Johns Hopkins University data directly, so it can put that up into the map, and you can click on each state and see when it was updated, how many confirmed cases, and how many deaths have occurred in that area. And so you can just click around there. If you zoom out, it's actually a global map that you can see what's going on around the world. But in the dashboard itself, we like to focus on helping the transportation sectors and all that stuff. One of the things we added for Pennsylvania, Tom, is when Molly sent out the notice of some of the rest stops being open for truckers that don't have facilities open, but they do have porta potties in place. We went in and created lat lawns for each one of those exits. We can change the base map to satellite, go right into these exits, and you can see the rest stops where we've located the points of the exit for the rest stop itself, and you can see what they have, where it's located, and the 5 portable toilets, 1 ADA accessible at these rest stops, because they've closed the facilities. There's nobody working in there, but we thought that this might be helpful the thing is that you just need to get the address out. They were finding in Pennsylvania, I think, that the truckers were getting tired driving through Pennsylvania. So these are some of the data sets we can add and pull directly from anybody's services for real-time collaboration.
Let me just ask the group, use your text box if there's some states you want to have added to this. We have, we're trying to track the waivers as well. So if you have some states, just type it into the text box for everybody, and Dave, you can pick it up after the webinar. Okay. All right, let me pull the screen back and let's get started. Hang on a second here.
Molly's on.
Hey, Molly, good morning. So, first of all, let me welcome you. Hi, Sherry, good morning. Thank you for joining us. We've had a number of folks join the call that are new to the group. So I want to welcome everybody. This is a weekly phone call of the SISE working group, the Sensitive Information Sharing Environment work group. Everybody on this call has been vetted, so we can talk here freely without media, without regulators, without any concerns for that. We decided to convert we have a 9 o'clock call, which is operational, and a 10 o'clock call, which is GIS related. We decided to convert these two calls to problem solving for COVID-19. After a lot of discussion, we're going to look at food and fuel first and the supply chain issues. I've been working closely with Doug Baker and his folks at Food Marketing Institute, along with Sherry Stone in the fuel sector at the Petroleum Market Association of America, Edison Electric Institute on the electric side, Kent Kildow and Rodney at Sprint and Verizon. I know I'm missing some people, but we're going to start with food and fuel and look at the logistics issues today, the things that are pressing right now, and then we'll build a parking lot going into the future of future use cases. So just as a matter of backdrop, I sent out the agenda to everybody here for today. We'll cover just a short review of our process, then we'll jump right into our problem-solving process. So, Doug, I'm going to have you go first on the food side, and then we'll come back, Sherry, and discuss fuel as well, if that works. So we got a number of people on the call today, so I won't do all the introductions, but I'll be glad to send out information after the call. Okay, so we're going to, I'll just do some background and we'll jump right into the problems here. So many of you may not be aware of the SISE working group, but it is a problem-solving work group. Over the last 4 years, we've worked with Department of Homeland Security, and we developed a process very, very simply to solve problems. So these problems we look to solve are usually require state and local government assistance to help the private sector solve them. We have a criteria we go through that we have more problems than we have people to solve, but we try to look at is the problem simple, meaning can we solve it together, or do we need a letter from the Pope or some new legislation? That's too hard. That goes on the parking lot. Number one, is it simple? Number two, is it going to bring operational benefit to the private sector and states? That's the second criteria. If yes, we go forward. If no, it goes to the parking lot. And the last criteria is, can we show a result, something in 90 days? Why? Every one of you are busy. You're on phone calls all day long, and so we try to make this quick. If we don't show a result quickly, we lose people's interest. I lose interest, quite frankly, but when we can produce a directory, a path, a dashboard, a data set, an education, a webinar, when we can move the ball, that is what gets people involved. So this is our first agenda for the problem solving, so we'll tweak it. It might be a little chaotic at times, but that's okay. We're going to stay with this for at least the next 3 or 4 weeks at a minimum. So we have a 6-step process. It's up on the screen. We share this with everybody we know. First, we define the problem. We get agreement and understanding on the problem. Then we discuss the impacts across multiple sectors. Sometimes people don't have an understanding of what's going on in another sector that can impact them, kind of these interdependencies. Then we discuss the people that need to be involved, the data or information we need to solve the problem, the data security levels. Is it competitively sensitive? Is it we don't do any top secret kind of data, but is the information sensitive in any way? We have 3 levels of security within the sites. We're on level 1 right now, so we don't talk about anything that's super sensitive or super secret, but there are use cases we make it into that involve that. And then the last one is we identify possible solutions, short, mid, and long term. So what we've tried to do in 2019, we formed a number of problem solving or use case committees. As you can see on the screen, some of these are self-forming, which is helpful. Then we keep a list of our use case inventory. We categorize them by response, planning, research, security, analytics, training. And I'll send these slides out after the webinar. I just wanted to let you know a lot's been documented. And then we keep updates on these use cases in 2019. So you can see here we had fuel availability, commercial road, lodging, and pre-staging. We had a committee formed, templates completed, and possible solutions that we've implemented. Second one looks at other routing directions, faster declarations and waivers, reduced Canadian border delays, which I understand now the border's closed for non-essential movements, so I'm sure we'll have some use cases there. Private sector needs for closer coordination with states, how to coordinate better between states and industry after a cyber attack. And then the latest one we had was this urban area, kind of bio building, helping police and fire get to information quicker within buildings. And then lastly, we produced a number of solutions that were operationalized. I won't go through them all right here, but some of these are produced through partners. Some of these are produced through third-party organizations. Some are produced internally. Some are training. Some are data. Some are tools. Some are apps. Some are websites. Kind of all over the map. But we spend the time working the solutions go forward. So I'm going to pause there. If anyone has any questions, I'll send these slides out. So if I went fast, it was by design. I want to get into the problem solving. Anyone have any questions before we start? Okay, you can always use the chat area as well. Okay, very good. Let's jump into it. So today we're looking at really the food and logistics piece of this. I know I've been on the phone a lot with our states, the food sector, fuel sector, DHS, FEMA, Department of Energy, DOT. All of you have been involved in different pieces here. So what I thought I'd do is initially throw up some things. And so I'm going to have Doug Baker from the Food Marketing Institute address this. And at 10 o'clock, I think Carmela's going to join us, Doug, from C&S Wholesale Grocers. So
okay.
First up here, we're just going to talk to the rumor mill. We might be able to nip these in the bud quickly, and then we'll get into some of the current issues. Doug, I just threw them up there, so if these are out of order, forgive me. I put down the things that at least that I knew. So first up on the rumor mill, local government is commandeering medical and food supplies from the private sector. Anybody heard that?
I haven't. This is Doug.
Okay. We got that from the medical side. It ended up being kind of a false positive that apparently a local authority came to a medical site and was trying to get supplies. I think they worked it out. But anyway, there was no commandeering going on, so that's good. The second one, Doug, was rural truck drivers don't or can't want to drive into urban areas. Doug, have you heard anything about fear of the driver from a virus or security or any kind of things with deliveries from your standpoint?
It's been intermittent, Tom. It's more about what state and local governments with their shelter-in-place proclamations that have caused some concern or some question. We have quickly gotten out the letter from DHS, and many companies are actually creating letters that help them identify that they're a part of the essential infrastructure from DHS and SISE. So we hope that will continue to abate. But the federal government did also say that ultimately, at the end of the day, it is the local government's decision as to whether or not they're gonna enforce that strictly. So far, we have not heard any state governments that are saying that they're going to keep trucks from traveling through their containment areas or their states. But we anticipate and we have heard of instances and
have tried to address those as quickly as possible. It has not broken down the supply chain yet, per se, but we're keeping an eye on it.
Okay, very, very good. The next one up was truck drivers coming from west to east is what we heard, that they couldn't find fuel or food. The stores were closed in the rural areas.
That is true. And working with both the state retail food associations as well as the state emergency operators, we're quickly addressing that, and states are starting to identify critical travel and truck stops that would allow drivers that are on over-the-road long hauls to be able to stop. But it is an issue. We've heard from a couple drivers' spouses who have actually reached out and said, "Can you please help?" So that information has gone all the way up to the White House, and then back out working it locally to try and get it resolved as quickly as possible.
And Doug, from your perspective,
quick
what
question.
is the problem? Yeah, go ahead.
Quick question. Would you throw lodging in there with food and fuel as well?
Sorry, Greg, identify yourself and who you're with so people know. Sorry.
Greg McShane, DHS SISE, Integrated Operations Division. Would you throw in lodging along with food and fuel?
Doug?
Yeah, I mean, many of these, if you look at it strictly for drivers, many of them typically stop alongside the road and stay in their cabs if they're doing overnight. But I could see how that could be a potential challenge as well. So it just feels like it might be not as important as fuel and food. So that's an uneducated answer. I apologize, but from what we understand, many of the guys that are doing over the road, they can get to their location in a long day, and then if they have to do an overnight, they're typically pulling to the side of the road and staying in their cabs.
Okay. And Doug, why, from your perspective, why are these locations closing or closed?
They've been sort of caught up in the proclamations to close restaurants. They have seating areas. They were maybe caught up in the non-essential proclamations, and so we're just trying to get those things resolved. Unfortunately, when you're moving as quickly as everybody's moving right now, some of those things sort of fall through the crack, and people don't have complete visibility of the supply chain and all the adjacent influences on the supply chain. So it's just getting that information out as quickly as possible that there's been a constraint put into the supply chain.
Okay. And are there any other rumors? Yeah, identify yourself.
Sorry.
Yeah, go ahead.
Sorry, this is Dave Jones with GeoCollaborate. I just wanted to say if by the end of this call we have a location like the SISE to submit open rest areas or whatever that have food available, we could get that right into the dashboard to help the drivers.
Great.
Okay, that will be that'll be an hour by hour effort, I'm sure. Doug, are there any other rumors you're hearing in the food sector? And then Sharon, I'm going to turn to you for fuel. Are there any other rumors you're hearing that we need to either track or not?
Nothing that's of significance, but I do want to offer one piece of information that I think is also positive. FMI announced a partnership with the International Food Distributors Association yesterday, and it is to do matchmaking between food service distributors and retailers and wholesalers for excess capacity, drivers, and equipment. And we're working with the FDA to even be able to utilize some of the product. Now that the food service sector has been asked to shut down, there is a lot of availability. And so that has been a positive. We were concerned about equipment and driver shortages, and we still might see some of those in areas around the country that maybe there's not a big presence of either food service distributors or wholesalers. But what now retailers can do is they can submit we've created a fillable form, and it's on fmi.org. They can fill that out and it comes back to us, and then we work directly with IFTA in order to be able to create that matchmaking. So the positive is anybody that I've talked to this point from a wholesale or distributor perspective is feeling pretty good about right now the availability of drivers, and the equipment is like feeling good, but like right on the edge. We're moving a lot of high cube product right now. So, toilet paper, paper towels, bleach, water, they take up a lot of space. In a truck, they take up a lot of space in a warehouse, and they take up a lot of space on shelves. So they create the perception that the supply chain is strained, and it's not. It's flowing. It's just these trucks. You throw paper or water on a truck, and it fills up pretty quickly. So we could have some equipment issues because of the high cube nature of some of the products that consumers are looking for. But we're also looking at these types of same partnerships with other industries, seafood and produce, and we're having conversations with product manufacturers right now who have they typically have dual divisions, one that's focused on retail, one that's focused on food service. So we're having those conversations with product manufacturers further upstream that might have some of these finished goods in their pipeline, and or the ability to be able to convert some of their equipment to start producing more retail packed goods. So feeling really good about the supply chain right now. Unfortunately, we're running at capacities about 150% over a normal day. I had one store yesterday that told me they were up 350% in volume, and there's just not enough. There's not enough doors and trucks and people to keep up with that kind of activity. The products in the pipeline is just about 2 days behind. So just some color for everybody.
Hey, Tom, this is Sherry.
Yeah.
Can I come up with something in here? We're hearing the same problems about C-stores being closed.
Sherry, let everybody know who you're with. I'm sorry.
I'm sorry. Yeah. This is Sherry Stone with the Petroleum Marketers Association of America. We specifically have in Minnesota. They are looking to close this for all gas stations that have the C-store with it. They're looking to close the C-stores and only allow the pumps to be operated. So, yeah, this is just creating a further problem with people not being able to access food, especially in rural and urban areas. So, just wanted to give you that example.
Sherry, thanks for mentioning.
Excuse me.
That's
my name's Matt
Sherry.
Morrison. My name's Matt Morrison, Maine Energy Marketing Association. Yeah, we're having some issues up here in Maine because all the restaurants are closed, as you may know. Some of the truckers are having issues because they want to go, say, like the McDonald's or some quick place you can stop by. They're not serving anything in the restaurant, but they're only doing drive-through. The truckers aren't being allowed to actually access the food through the drive-throughs. Now, I don't know if this is a business decision or if this is a federal law, but it's caused a lot of angst because all they want to do is get some food and go, and they're being refused service. Is that anything that we can help them with?
We're hearing that too, by the way.
Yeah, it's a definite problem for us, and it's causing angst and anger, and it's not good because the food's right there, and they just won't serve them because they're not in the vehicle.
Right, and I've heard people having to use like DoorDash or something just to get the food from the store to their truck.
It'd be great if something went out, relieving that, letting people know, yes, you can serve through the window during this time period to help people out.
Do you think some of the issue is, do you think some of the issue with that is the size of the rig and some of the structural challenges that the drive-throughs have potentially with overhead like coverages and stuff like that? Do you think that's probably, doesn't mean they can't
that's absolutely it. But what they're doing is they're parking their rig far away from the restaurant, and then they're trying to walk to the restaurant to get some food, and the doors are closed because there's no in-store dining. And then when they walk up to the window to order a burger or whatnot, they're being refused service.
They're being refused at the window. Okay. I'll see if I can't get some messaging out.
So I've made a note of. So is that? Let me ask the private sector a question. Is that a private sector issue? Is that a state issue, or both? Doug?
It is a private sector issue. It becomes a state issue or a federal issue if they're doing it because of a proclamation. If we can, what I'll do is we have contacts over at the National Restaurant Association, and so we can get some messaging over to them that maybe they can get out to their member communities to say, hey, be aware of this, that this is happening, and see if you can help. If we get responses back that there's another reason why they're doing it and they need some sort of relief, then I believe that it becomes more of a public sector issue, and we have to get those approvals in order for them to be able to do it.
Okay. I know Molly, can you hear me? I don't know if any other states are on, if you want to comment. Okay. Very good. And Sherry, just so I made sure I understand, in Minnesota, I'm sorry, you said in Minnesota they were closing the port?
No, they are closing the convenience store. Where you have a gas station and convenience store, they're allowing the pumps to stay open for the fuel, but they are wanting to close the C stores. That's at the state level.
Got it.
Hey, Tom, this is Fred. Go ahead, Fred. SIP program manager for Maryland. So we're talking food. I'm going to sort of ask an offbeat question here. What about food for animals, farm animals, the feed, those types of things? Do those have to go long distance? Do they come in by rail and then disperse locally? I mean, is there any problem with the continuing transportation of feed for chickens, pigs, cattle, that type of thing?
So this is Chuck Reinhold, DHS, in the Infrastructure Analysis and Assessments Division. I live in a very rural area and have livestock and horses, and feed is an issue out in the rural areas. I don't know if that's because of bulk transportation or bulk production issues, but there are starting to become shortages out in the rural areas for those items.
Thank you.
Hey, Tom, this is Tony Hurley.
Okay, Tony, go ahead.
Yeah, I hate to be a buzzkill to everybody, but one of the things that I was just thinking about as you're going through this. Yeah, this is Tony Hurley. This is Tony Hurley. I retired from a utility after 37 years, and I now work for Wood O'Brien's, the consulting firm. Tom, as you take a look at everything we're talking about, hotels, meals, and just the fuel and everything, I just want to get everybody in the mindset that, I hate to put a crisis on a crisis, but in 71 days, the hurricane season starts, and they're predicting some activity. And as I sit back and I listen to the things we're covering, the fuel issue, the hotels, the meals, considering the mutual aid programs that go on in the United States, that is going to restrict able to move crews no matter what type of utility you're in, down to a hurricane. I'm even thinking about individuals that might refuse to share a room of what's already very sparse hotel. The staging site campers that they give. I even suspect people would even push back on that. So the only thing I'm suggesting is, as we go through here, can we just be in that mindset of what are we going to do if we get hit with a hurricane or even an early hurricane and have to start moving? Because I don't know that anybody else is addressing that level of planning right now, and I think it needs to be done.
Yeah. Noted. Thanks, Tony. Doug or Sherry, any other rumors that we want to address?
No, I think they've been addressed. Sherry?
I don't know if y'all. Yeah, just one more second, Tom. Yeah, we have another issue. It's not a rumor. Do you want me to bring up the other issue, or?
Yeah, just I'm going to document it. We'll come back to it if we don't dive into it. Go ahead.
Okay, so we would like to find a way to encourage the common carriers to implement a way for drivers to obtain fuel delivery signatures without the driver having to go and contact the store employee. And it's very simple, really. It could just be an electronic signature, even a text. But so our drivers who work for private companies, the private companies are definitely implementing those processes, and we're just hoping to get the word out to the common carrier companies as well that it's important in order to help prevent the spread of the disease.
Very good. So the issue is, I come and deliver fuel. I normally have to go in the store, get a signature that they've got it, which now I'm afraid of the virus or whatever, right? So there's distancing, right? And
right.
the issue is coming.
Yeah.
Go ahead.
Go ahead. Well, it's not even so much being afraid, but just trying to prevent the spread, because if that driver comes in contact with each store that they go to deliver, there's a lot of contact.
Okay, so the issue then is, how do we get the signature for the fuel without the driver going in the store?
Well, it's easy to do that, and our private carriers, our private businesses, they are implementing their own processes, whether it be just an email or a text signature. It's the common carriers that also need to implement those sorts of policies within their organizations.
Forgive me, Sherry. I have no idea what a common carrier is or looks like.
I'm sorry. So common carriers make up about 50% of the tanker trucks that our drivers use, and it means that they are not owned by the marketer. They are they're private companies that have trucks, and they lease them to our marketers, and they make up roughly 50%.
Okay. And can you explain their process now? They're probably pulling a bigger load, I would assume.
Not necessarily a bigger load, but so every company has its own process, and so 50% the private ones are definitely implementing their own systems. But right now, from what I'm hearing anyway, some of the common carriers are still using current systems, which are more like, the driver goes into the store, an employee signs a receipt that they sign the bill of lading that they have received the fuel, and that's the normal process.
Okay, got it. Anybody got a thought for Sherry on that one? Richard Thimble, you got a question or a comment?
Yeah, hey, it's Rich Trimble, DBI Services, infrastructure. We take care of a lot of the infrastructure for multiple states. We manage a bunch of rest areas in multiple states also, but same issue with getting food. It's beginning to be a bigger issue with our employees, especially any crews that we have deployed, because they're also in bigger trucks and they can't drive around these different restaurants to get food. And one restaurant, I don't know if it was McDonald's or Burger King, one of those places said, hey, it's a safety issue, we're not allowed to serve if you walk around in the drive-thru. And they're like, well, what other way you want me to do it? Drive the truck around, I'm going to tear apart half your building. I said, well, it is what it is. So yes, it is an issue. And it started in Northwest, and now we're getting it in the Northeast too. So definitely an issue.
Very good.
Hey, Tom.
Megan,
I'm going to, this is Dave Jones, just to throw out an idea for people to think of. If we had location information on those trucks, we could set up separate dashboards that restaurants could pull up, where they could see trucks pulling up to their restaurant for approval to come in and get food, or to know that they're coming into their parking lot, or things like that. That information could be shared out in real time, and those restaurants and truckers could access the dashboard in real time.
All right, thanks, Dave. Megan, you got a comment? You got your hand raised?
Yeah, can you all
Identify.
hear me okay?
Yeah, you can hear you. Identify yourself and who you are. Thank you.
Yes, thank you, Tom. This is Megan Vitula. I'm with the Edison Electric Institute, and if you're not familiar, that's the trade association of investor-owned electric utilities. And I just wanted to kind of add a little bit to the conversation I was just hearing about planning for hurricanes and mutual assistance, and raise a couple of issues my members have been raising up to me. And so, one of the things we're very focused on is planning to make sure we can roll our trucks for mutual assistance in case of storms or any other issues that would require that activation. So one of the issues that's been raised, I see, is already on your current issues list, which is the faster CDL license approvals due to those potentially delayed physical exams. Something that also kind of dovetails off of that is the requirements for the random drug and alcohol testing. We're getting concerns from our members about on two fronts there, that there's social distancing measures that folks are going to become more wary of going into medical environments to get some of those tests done, and also that there's the potential for lack of availability of that testing as more medical professionals are potentially pulled into responding to COVID-19. So I wanted to add, if there's any way to sort of seek some flexibility in how the random testing program is implemented for the duration of this crisis. And then a third issue that was just raised to me overnight in terms of mobilizing those emergency trailer accommodations that we're bringing to some of our plant locations in some areas. I'm being told that our drivers, operators have to have federal emergency declaration papers to have in their vehicles, and they're not sure how and where to get those papers. I'm not sure if that's an issue for this group necessarily. Maybe it is, maybe it isn't, but that was just another issue that we're kind of figuring out how to answer for our drivers to make sure they can move what they need to move in the right places so they can be where they need to be to keep the lights on and to roll mutual assistance should that be activated.
Okay, very good. That last one, there's a solution already out there to get you copies of declarations and waivers. There's actually several. I made a note here, and I'll send you some links to that. One is directly from the Federal Motor Carriers on the declarations they've issued. We have a dashboard that Dave Jones is running, and I think Healthcare Ready has a wonderful website where they've been tracking all kinds of medical declarations, federal and state, and I'll send you those. Okay.
Excellent. Thank you.
That's for the third one you brought up here. The federal, the licensing and CDL. My understanding is, and somebody correct me if I'm wrong, that's a federal issue. That they control those regs and processes. I don't think we have any states on. I don't think that's a state issue. I think that's a federal issue, Megan. So I think you're already working that channel. And I sent a note yesterday to Alex Keenan at Federal Motor Carrier Safety Administration. He said, "Yep, we got it. We recognize it, and we're on it." So he gets back to us as soon as he has something, and I'll share that out with the group once we have that. Okay.
Sounds good. Thank you. And do you think Alex would also be the appropriate person to kind of float the question about the drug testing with, if he's also sort of looking into the physicals? I think it's sort of similar concerns that are motivating both of those issues.
Alex, I understand Alex is looking at all the issues, right? Physical exam, drug, alcohol. I know there's other things, and I think there was immigration. There was a lot of issues around this. I had no idea there was so much complexity behind it, but there is, right?
Neither did I until a couple of days ago.
Yeah. Well, I mean, this is all done to keep us safe, but in times like this, this is where it's a catch-22, right? But that's a federal issue handled by DOT.
Okay.
Or Federal Motor Carrier. Okay. Okay. So Doug, let me go. We've walked through a number of the rumor issues and current issues. So I wanted to before it got too late, I wanted to give you the opportunity. Is there a pressing issue right now you need coordination with states that we can work on with them or with our trade groups as well? Anything that, if you had to pick the top one, what one would it be for you right now in the food sector? I know that may change, that's fine, but I wanted to zero in on one if you have one. Doug, you still with us? Doug Baker?
Tom, sorry, I'm running two phones at once here. I have a colleague on, Marjorie Dupree, so she might have heard the question and can help answer that.
Yeah, we were just looking for the top issue. Marjorie, maybe you can throw in there. What is something you guys in the food sector need help with right now with coordination with states or other sectors for that matter?
I think we're pretty plugged in, and I would really have to check with our federal team. It's overwhelming. I can't name one top issue. Like Doug has said, they're just pushing the flow through as hard as they can, and we appreciate the chance to stay in touch about it all at all levels.
Okay. Yeah, and I realize it's a bit overwhelming right now, but we want to use this forum every Friday to pick one. If we can get a quick win, we'll get our states involved, and I think this is going to be a work in progress. So thank you.
Mm-hmm.
Sherry Stone, anything on the fuel sector side?
I think the common carrier issue would be probably the biggest one, just because it affects so many people. But it's like they just said, it's a tough call to say which one is the most important. But yeah, I would start with that one.
Okay, and let's jump into that real quick. So, if you can review the process currently today, and then tell us what the problem is.
So the process today is that the drivers who are using trucks that are owned by a common carrier, at this point they go in order to prove receipt of fuel delivery, they go into the store and get a store employee to sign the bill of lading. And what we would like to have is the ability for those drivers to obtain a signature in a way that does not, force them to contact the employee or go in the store. And again, that can just be as simple as a text or email.
And so, just so I am clear, both the common carrier and the fuel distributors are are delivering fuel, right? I'm failing to understand the difference between the common carrier and fuel distributor.
So let's start with the marketing companies. You have the companies who are delivering or distributing fuel. Some of those companies own private fleets. That's about 50% of those companies own private fleets, and they will implement this policy. The other 50% are also privately owned, but not by our marketers. And so they, it's up to them what kind of policy they have, and we just want to, encourage them to do this.
So is a simple way to say that is some of these delivery trucks are privately owned and some are corporately owned?
Yes.
Okay. Perfect. And is that a state issue it can help with, or is that a private issue?
I think it's a private issue, but I believe the states could certainly encourage that to happen.
Okay.
Be implemented.
Okay, I'm just taking notes here.
Yep. Thank you.
Yep. This is
Fred.
Go ahead.
So Fred Pereira, I'm just wondering, is that more of a, say the company that owns that particular fuel, that gas truck stop stations? I don't know if the state would actually tell the business what procedures they have to run. See what I'm saying? feel like the government telling the private sector, here's the way you have to do it.
Well, they're telling them to close, so I think they could certainly tell people to, here's, again, it wouldn't be mandated, but it would just be, hey, consider doing this.
Could you please do this? Yeah, I mean, it may be more of a during emergency operations, truck drivers are not required to sign for fuel. The company itself just goes ahead and keeps track of that and then bills accordingly.
Well, I think we do want some sort of signature, but it just doesn't have to be person to person, and it doesn't have to be the driver going into a store.
Absolutely.
Anyone else have a comment on that?
I just know that from living up in Pennsylvania, there's already pushback on the governor as to what can he really say is going to close or not, short of him declaring, that the government's taken over everything. And actually, I was on a statewide law enforcement call last week where law enforcement, state police are actually having the conversations about we can't arrest our way out of this, in that there's not enough police to go around arresting or citing everyone who determines they're not going to abide by a particular government mandate.
Yep.
That's consideration.
That's the reality.
Right.
Yeah. So Sherry, does anyone have a comment on this from the electric sector or comms fuel? Okay. I think the reality of this is that we can let the states know. I think the private sector is going to have to carry this one, Sherry, only because I know how stressed the states are. One more to them is not going to happen in reality, right? Now, what this could do, and I know you're working the issues as well, what this could do is help the states understand that when they close this, here's the cascading impacts. That can be very helpful.
Right.
Yes.
But as far as the process, that's going to probably have to be worked out by the private sector. And I was hoping on this call, maybe next week, we could get, has somebody done this? Has somebody got an idea of how to do this faster, better, cheaper? Sarah Baker, can you hear me? Okay. Okay, good.
Hey, Tom.
Yeah, Dave.
Dave Vanderbilt. You might want to reach out to somebody, one of your contacts on the West Coast in California, because I'm sure all of these things are going to bubble up with Governor Newsom's shelter-in-place mandate that they put into effect last night. A lot of these things are going to, between now and Friday, are going to develop and solve themselves. So it might behoove us to get somebody from the West Coast on this call.
Good point. Thank you. Will do.
Hey, Tom.
Yeah, Dave, go ahead.
Just one quick update. I've gotten two separate emails. This is just something to consider from local homeowners associations. The word is passing around asking neighborhoods to put back up their Christmas lights to bring back cheer to the neighborhood. If people do that, will that have a huge impact on the power generation issues? Not sure.
This is Fred Pereira. I saw that on social media, and that was my first reaction, was that we don't need people demanding more power through those types of things.
Yeah.
I mean, it's less a burden to just put up an American flag than it is to put up all your Christmas lights again.
Any comments from the electric sector?
Tom, Dave Vanderbilt again. I'll give you my perspective on it. With all these businesses closing, I think demand's going to go down. People are going to their homes. I see it probably as a wash, but we'll probably have to watch it pretty closely. But I don't see the minimal load that Christmas tree lights put up being that much of an impact on the distribution grid, at least.
That could be. Yeah. Tom, I do have another question concerning drivers, because we didn't really address there at the end as far as driver fatigue, or I know we talked about shortages, but are we seeing that? Have the time restrictions, the amount of time that a driver can actually be on the road, has that been lifted? So more drivers can spend more time on the road?
It has for those who are responding directly to the emergency, like providing medical supplies or fuel for hospitals, that kind of thing.
Yeah, there's a waiver that has gone out. It covers all critical sectors from health to food to fuel, with waivers eliminating the requirement for the 15-minute break, the 36-hour reset. We're also trying to get some additional waivers on age restrictions, being able to go across state lines. So those might still yet to become.
Who was that? I'm sorry.
This is Doug with FMI.
Okay, Doug. Thanks.
Up on the screen, I pulled up 3 resources that you can use. I put all the URLs in the chat area. First one is Healthcare Ready. They've done a tremendous job pulling information together for their members. Declarations, both health and federal and state. This is a live map as well. That's a resource you can use. I know we've been sending a lot of people there, especially from the health side. Dave Jones mentioned that the Fleet Response Working Group has this and getting ready in case this starts to impact situational awareness as it relates to power restoration and fleet movement of resources. And the last one I put in the chat was the Federal Motor Carrier Safety Administration, where you can download the national declaration for this event, which I think, Doug, is what you referenced as far as removing the hours of service issue or expanding that?
Correct. Yeah.
Yeah. Okay. Very good. Okay.
Hey, Tom.
Anything else? Yeah, go ahead.
Tom, yeah, it's Jeff Placus. I just wanted to, bring something up. This is a good forum to do this. Us in the utility sector, we always talk about speaking with one voice and the importance of getting a message out in one voice. And I've observed, that's not really happening that much in the public sector. There's a lot of avenues for being able to provide information. For example, you can look up the cases in a particular state, either on the state health department site or on the CDC site or on the World Health Organization site or Johns Hopkins. And if you look at them all within seconds of each other, yes, they definitely put down this information was as of 9 a.m., as of 9:30, as of whatever. But when you look at them, they're not even close. I mean, and that speaks to the issue that we've all been dealing with of that, highly reliable information. When I look at that from the private sector, it dissolves my my faith in that information that's being provided by these many different sources. I know that everybody wants to get the message out, but they're not speaking with one voice, and it becomes very confusing. Is it 1,300 cases or is it 2,600 cases? I mean, that's a big difference. Twice the number. For one number to have been reported at 9:30 and another one to be reported at 9:45, and I've got screenshots of this. I mean, it's a concern. So, public sector needs to get on that whole speaking with one voice issue and try to get that message out consistently, because it becomes confusing. And it just feeds into the concerns.
So Jeff, let's start right now. I've got HS on the phone. I think this is a federated agreement, right? This is where we have to look at it. We got 20 things. What are you all going to agree is the source? And I wanted to invite DHS, or we don't have HHS on the phone, but from your perspective, Greg McShane, what is the federated source for COVID-19 cases at DHS?
So, Tom, I'll have to, we are publishing our reports from our SIOC, our SISE Integrated Operations Coordination Center. Those numbers, I believe, are based on, I can't say because I don't know, I haven't been in on a lot of the operational decisions here, having been now remote. But what I believe we need to do is agree upon whatever that authoritative data source is. And it's okay to have several data sources feeding into whatever, but as long as it's documented as whatever that source might be. For example, Eagle Eye. This was an issue probably almost 10 years ago when we were agreeing upon an outage number. What's the proper outage number? And what we did was we defaulted right back to, the Eagle Eye tool that we were using as the official numbers that we were publishing from the federal government. Here's a new kind of scenario with COVID-19 that I will get back an answer to you guys on how we were coming up with our numbers, but I believe they're coming straight from HHS and whatever the authoritative data source is for HHS. But
hey, Greg.
Yeah, go ahead.
Hey, sorry, this is Chuck. So yes, that was true. The case that we were pulling from HHS, but also from Johns Hopkins University, who is tracking internationally as well. And as of this morning, our report from the SIOC states that HHS is no longer sharing the amount of COVID-19 cases, but Johns Hopkins University is still reporting. And as we've been using them as well to bump numbers between HHS, two sources there. It looks like right now we're switching to one source, and that's Johns Hopkins.
Okay.
All right.
Thank you very much.
Thanks, Chuck, for clarifying that.
Is Melanie, can you hear me? Melanie Mackin from Healthcare Ready?
Hi, yes.
There you go. Would love to have you guys weigh in on this. Is the private sector, we run into this all the time, Melanie, where we have multiple sources of data and we just have to agree that we're going to use this one primarily versus that we can still use all the rest. But where are you pulling for your members? I mean, this is your sector. What's your thoughts about this?
Sure. So resources like the Johns Hopkins dashboard, as well as resources from reliable news outlets like the New York Times or the Washington Post, they're pulling data from state level and local level outlets. So they're reporting in real time, which is why you see a huge jump in numbers from them, as opposed to resources like the CDC, who the official numbers. So they're only reporting the confirmed cases that have been tested with the lab and are finally going into their surveillance system. So that's kind of why you see that discrepancy. So, at the end of the day, the CDC numbers are the official counts for the US, but we also can use these other resources like the Johns Hopkins dashboard to get a sense of what the real-time numbers are in terms of people who have been tested and are suspected of having a confirmed case. So for the official numbers, we use the CDC, but we're also pushing out the Johns Hopkins dashboard as well as the news outlets.
So, Jeff, any thoughts, comments?
Yeah, I don't know if my customers had 3 different ways to get a number, or the media had 3 different ways to get the number on the outages in my service territory, they're going to pick the one that portrays the situation in the most bleak and dire circumstances. I think it needs to be based on reality, what the true number is. I'm a firm believer in the integrity of information and the integrity of data. And this is not, I mean, I just looked now, and in New York State, in 3 different sites, including the GeoCollaborate dashboard, is 3 completely different numbers between New York State Department of Health, CDC, and wherever GeoCollaborate is sourcing its data from. So I just, you know, it's a concern.
So let me ask this to the group. Given the current scenario and what Melanie just mentioned, is it possible to have one place? I'm not sure it is, because they're looking at data from different sources. Melanie, correct me if I'm right. Correct me if I'm wrong. Each one is doing a different thing. It sounds like was that correct?
Yeah, that's correct. And if you look on the Johns Hopkins dashboard, it does list where it's getting its data from, and it is multiple sources. So that's why that number tends to be higher, because it's collecting from multiple resources in real time. Whereas for the CDC site, they're only updating it, I think it's once or twice a day. So you do see that lag in the number of reported cases.
Tom, this is why data governance is so important. This is the exact reason. So I think that it's important that the group decides. I would recommend CDC and the limitation that it's only updated once or twice a day, but it is the number. And everybody just understand that. It would be, I would recommend settling on that one, because the other ones, the sources are variable and you don't know, and their sources could change, and that introduces a lot of uncertainty in the ground truth of what you're looking at.
Yeah.
So I'll even add, you know, this is only reported cases. You know, what about the unreported cases that are out there? I mean, what are you really looking for as far as numbers? Are you looking for a number that is kind of gives you a benchmark of kind of where we're at and where we're trending? Or is it something that, hey, we need the exact number? You're never going to get an exact number.
I would say recorded.
Yeah, to follow up on
recorded
that.
Cases.
Yeah, recorded cases, and then also the CDC does report the number of people that are under investigation. So to follow up on whoever just said, I'm not sure who just said this, but the CDC is official case count. So that is the most, you know, it may not be the most accurate in real time because it is not updated in real time, but it is the official case count.
Okay, so CDC is going to be the official current standing number, but it sounds like Johns Hopkins is going to be a little more time, correct?
Hey, Tom. Just one little point is on the Johns Hopkins site, it says their data sources are the World Health Organization, CDC, ECDC, NHC, DXY, 1.3 acres, and worldmeters.info, state and national government health departments, and local media reports. So, and I just checked, Jeff, try to refresh the dashboard, I guess, because I just checked we're pulling our service directly from Johns Hopkins, so the numbers are exactly the same. I just checked with New York too, and just did a screen capture that both GeoCollaborate's number and Johns Hopkins is the same.
Okay. So Jeff's point from the electric sector was
that even Johns Hopkins sources and is not authoritative, what we would call the system of record for this, which would just be CDC.
Yeah, I think that's the point that I'm trying to make, is that, you know, I'm looking at CDC, which is a federal government site. And I'm looking at New York State Department of Health, and those two numbers are not what Johns Hopkins is reporting. I don't know where Johns Hopkins is getting those numbers from. So, you know, that's I think where I'm getting at is you know, that whole issue of just trying to speak with one voice, and it's just a try. It's a good to have. I understand that people have the need and desire for information in situations such like this. It's just, you know, what is the system of record? What is the truth that's out there?
Hey, Melanie, Melanie, can you hear me?
Yes, I can hear you.
Thank you. CDC pulls data from where? Do you know their sources they pull from?
I'm not entirely positive on that, but I believe they're just pulling them from state departments in their surveillance system. But they're public health laboratories that are testing, as well as state departments of health. I believe that's where they're pulling from. If anyone else has any insight, feel free to chime in.
If you go to the website for Johns Hopkins right now, you'll see the data sources listed underneath the map.
I'm not talking about Johns Hopkins, Dave. I'm talking about CDC. Does anybody know where their CDC pulls their data from internally?
Gotcha.
There's an official infectious disease reporting system. I forget the name of it, but I would bet dollars to donuts that it's coming from that.
Right.
Hey, this is Greg McShane again. Just looking at our daily update brief here for CISA, it's saying that HHS is no longer sharing the amount of COVID-19 cases, and it spits out, as of 0500 Johns Hopkins reports, and then the overall U.S. Cases and deaths. So that's what we're reporting on.
CDC, right? Not Johns Hopkins. Or did I misunderstand you, Greg?
HHS is no longer sharing the amount of COVID-19 cases. That's what it's saying.
Okay, so what I'm driving at here is a federated agreement, folks. We've got to come to an agreement on what's going to be the system of record, to Chris and Jeff's point. Whether it's right or wrong, you all need to agree so that we know we can use Hopkins, we can use but we've got to come to an agreement for you all, and especially with I think Healthcare Ready is on top of this, probably watching all of it. This is what they're good at. So I guess Melanie, if the group were to decide to use CDC as the system of record, they can certainly use Johns Hopkins as the latest real time. What I'm hearing, does that sound accurate?
Yes, that would be accurate. I definitely rely on the CDC as your primary source of information.
Okay.
And this is Greg. I agree. I agree there, but it's okay to have different data sources, just as long as we identify what those sources are and we define which is the authoritative data source, and it's vetted information that's either coming out through CDC or HHS or even, through one of the other official sources or agencies on the federal side.
Yeah, I think that's the point that I was trying to make. It's okay to have that, but, let's identify them that, this is ORL 1, this is ORL 3 or ORL 2, and, allow the consumer of that information to make the determination of what they wish to see. That's a very valid point.
Well said.
If I were to, off the top of my head, say, I would imagine that CDC and the New York and the state health departments in whatever state they are probably ORL level 1 or 2. I would probably say that because Johns Hopkins is pulling data from that and other sources, it may not be level 1 or 2. That may drop that down to a level 3. That's just my thinking, just off the top of my head without going through the actual analysis.
Okay, comments?
Hey, Tom, Pat Shaw from PA Endeavor Group.
Hey, Pat, go ahead.
Serious biz. This is very, very similar to during the Gulf War, if we were exposed to chemical or not during attacks, especially Scud attacks. If we start relying on multiple sources of information, I think it's going to be very confusing and it's going to create more panic. And I agree with the one voice, and I think CDC is going to be the lead, and that's the lead that you should look at always, because we're going to have to rely on, as this gets deeper into it, the government's going to have more control, and we're going to have to look at government resources and sources of information to make decisions on a timely basis. And the state, the local, county, and federal resources of information is what we need to rely on, and they're going to take most of it from the CDC.
Yeah. So, thank you for the input. I'll just go down the list.
This is Chris McIntosh. Sorry, I hopped in late and didn't introduce myself. Sorry to wade in.
Okay. Let me just walk down the list here. We need to have a federated agreement on it. So right now what we're discussing, the CDC is a system of record, which I know Healthcare Ready, FEMA, DHS, they're all pointing to say that, I think. But Hopkins seems to be different because it's pulling from other sources. So the question right now is, are we in agreement on using CDC as a system of record, regardless of what its current state is, so that we can at least, within this group, if we get into the data discussion, we can talk about that from the source. So Doug Baker, any comments or thoughts on that?
I'm going to have to think about that, Tom, a little bit.
No problem. Fred Ferrer?
No, sir. I actually started looking at this about 5 or 6, 7 weeks ago, and I was presented by the same exact dilemma, who to use, because some of them were partial. There's also an outside non-political source that you could use called BNO. They're from Sweden, or they're an international firm. Anyways, their numbers seem to be more reliable to me than anything else. But if you want to use CDC, that's fine. I just think that, well, never mind what I think. It's you pick somebody. It's whoever the nation wants to have lead it, right?
Yeah.
I think we're not advocating one and only, but we have to have a agreement on what is the one we're all going to use to speak from. But we can use anything. If you have a link, by the way, put it in the chat box.
I will.
You can have
it seemed to be pretty reliable. Unfortunately, on the international side, we're stuck by what other countries report. So, to be perfectly candid, as an old Cold Warrior, I don't trust the Chinese government as far as I could throw them.
I think on the ORL ranking, they'd be a 4. It's just you can't nail it down. Okay.
I think we need to add a 5 on that for that one.
Yeah, well, that's a whole.
I don't even think they're worthy.
Okay,
yeah,
so
I'll put the BNO link up there for you to look at.
So what we're coming to is a federated agreement as a group that we're going to use CDC as the authoritative source, but we certainly can use Hopkins or state sites. To Jeff's point, the states might have it faster. That doesn't preclude us from using them, but I think Jeff brings a good point. We've got to have we got to have common agreement, at least within this group. It can emulate from here, but I think that's what I'm hearing. So, Mark Sikorsky, any comments?
No, Tom, just listening in. I joined a little bit late.
Okay, Tom, this is Doug, and most everything that we've been doing has been under CDC guidance. So I would probably agree with that, but I can also tell you we're getting feeds from a lot of different places, and I'd actually have to go back and look and see what their sources are. But any kind of recommendations we do for the industry, they're all based on either CDC or FDA guidance.
Okay. Yeah, and I think that's the spirit of what Jeff's request is.
Yeah, and you know, Tom, just Jeff again. Just again, I apologize for poking the hornet's nest, so to speak, with this topic. But I've been looking at all the different sites and to gain the information. And I just clicked on the about for the Johns Hopkins, and it has a question and answer or an FAQ. And one of them is, why does the data here differ from data on other websites? And it even says the website relies on publicly available data from multiple sources that do not always agree. Okay, so I don't know what to make of that. To me, I need the integrity of that data. That if it's slower, if this is faster, that's fine, but faster is not always accurate.
Yeah, accurate, right.
This is Melanie with Healthcare Ready. Yeah, that's why we've been pushing the CDC numbers. They are the official source. That's what all of the federal agencies are pointing to as the official source. So, that's why the Johns Hopkins does have multiple resources that they pull data from, and that's why it is higher. But that's why the CDC is considered the most accurate at this point. And then I just also wanted, looking at the notes that you just had up, I think I might have misspoke earlier. The CDC numbers are only updated once a day, and they're updated at noon. So if you want to go back and check that today at noon, you'll probably see that those numbers will be higher.
Well, I learned something right there, Melanie. I was not that. Very good. Okay. Okay. So from a working group, it sounds like the authoritative source, from a messaging standpoint, is going to be CDC. Certainly, Johns Hopkins and others are usable by anybody. That's not the point. But I can tell you from all the calls I've sat on, state, urban area, New York City, all over, they're all pointing, Jeff, to CDC as the authoritative source. Okay, I think we'd be in good standing if we agree to do that. So, because I don't think we're ever going to have one on this COVID-19. There's just going to be too much. So.
Hey, Tom, this is Dave. Just a quick question. Would you suggest that we remove the Johns Hopkins numbers from the FRWG dashboard?
That's a function of what the work group of the GIS folks would prefer. I think that's a question I'd put out to the group.
This is Sherry. I think it's good to have that as well.
Have what, Sherry? I'm sorry.
The Hopkins link or data.
Okay.
Okay, we'll keep it up, and we can also look for the CDC numbers as well. We've done an analysis over the last couple of weeks that the CDC numbers tend to be lower than the Johns Hopkins numbers.
Yeah. Well, today I learned a little bit on why. I didn't realize. Thank you, Melanie, for bringing that up. I didn't realize all the sources that they pull from. But Melanie, at your site though, you're pulling from the CDC, right? I think I have it up on the screen. I think that's correct. No, wrong map. Hang on.
Yep. So our U.S. map, we're not tracking the number of cases on that. The purpose of that map is to track emergency declarations, public health declarations, access and reentry, any curfews or closures. In our situation reports, we are reporting case numbers just for situation awareness. We do pull from the CDC, but we do make a note on the situation reports that the numbers have likely changed from the time that we have reported. So just keep in mind, this is a very dynamic and evolving situation. And no matter where you're looking, case numbers are going to be changing by the hour. So, having the case numbers in mind is good for situational awareness, but they are changing.
Amen. No, you hit it right on the head. It's dynamic, very dynamic. So, okay. So, I think we have a federated agreement. We'll use CDC as the authoritative source, but certainly Johns Hopkins and other ones, which I'm getting a number of them now shared in the chat box. You guys can see it. So look at your chat box. You can get it. Thank you for those who are sending it. So from a let me ask this question. Is George Eason on?
Yes, sir. I'm here.
George, I wanted to invite you for comment out in Texas here. Any issues that you guys are preparing or planning on in the electric sector there?
So, well, we've implemented our pandemic platform. We've isolated and segmented our workforce and just following social distancing and then daily status calls. Not really seeing a major impact here yet, but we're planning for it. Basically, that's it for now.
Okay. Are you having any or expecting any issues with drivers availability or?
At this point, no, but it's still early on in this region of the country. Our struggle to this point has been getting sanitizing, the hand sanitizers, Lysol cleaning supplies, Clorox, things like that. Our logistics group's working through local vendors and national vendors trying to source these products. That's the only real thing that we've struggled with. Of course, finding masks and latex gloves and stuff like that, but we're not to the point that we would need to deploy those just yet. But we're trying to get them in stock so that we have them if needed. We have a limited supply for our first responders, but that's just where we're at now. Like I said, we've implemented our pandemic planning protocol and segmented our workforce and divided it up into the smallest segments that we can, and then tried to isolate. But at this point, we're just waiting for results.
Yeah. And what data are you guys tracking presently?
The CDC data is what we've looked at for the most part.
Okay, very good. Okay. So,
hey, Tom?
Yeah, go ahead.
It's Jeff Plagas. I got to jump in a couple of minutes to hit another call at 10:30. Just wanted to, basically give you a quick comment. Very, very similar to what George just said. We have a large percentage of our associates, both management employees as well as collective bargaining employees, that are working remote, working from home, and keeping only, essential field personnel that are required to be able to report in to coming to work on an emergency basis. One of the things, and I'll share this with the group because it might be something that I wanted to bring this up earlier. It speaks to entering locations. One of the things that we've instituted is we have a questionnaire that supervisors and managers are asking their employees that are coming in on a daily basis. Are you feeling okay? Have you had a fever? Have you visited any places where somebody was suspected of possibly being infected? There's a short questionnaire of about 4 or 5 questions that we're asking each other when we do have to report in to a work location. But in addition to that, it's questions that we're asking customers if it is absolutely a must to have to enter their residence. And similarly, the first thing that I thought of, that might be, it might be something as a simple questionnaire. And I think we got it from either CDC or it came from the state health department. Those questions came off there and we crafted them for ourselves. That could be something that a driver can ask, through the door. Hey, before I come in, are you sick? Have you had a fever? Feel well today? Have you felt ill in the last 14 days? So before they actually make proximity and break that social distancing boundary, they can ask these questions of each other. And it could even be retail establishments say, hey, if you have these, don't enter this store. Okay, I'll send you a text, or I'll send you an email, or I'll call you. So those could be some of the things that could help any industry. It's not just applicable to the utilities.
So this is George again. We have a similar questionnaire protocol that we are using with all of our customers, and a tiered response rate. And but the thing I want to point out is you still aren't absolutely sure. We had an incident last week where a crew was responding to an outage on some of our residential underground, and they needed access to the rear easement to get to the transformer. And they spoke to the customer. Customer put his dog up, said, "Sure, come on back." And he went back there with them, and he stayed with them the whole time, talking, asking questions, doing all the normal stuff they do. And after the crew was completed with their task in that yard and leaving, he said, "Oh, by the way, I've been ordered to quarantine. And so y'all are the first people I've talked to in a week and a half." So the truth gets in the way of people getting their lights back on, and especially down here with air conditioning needs, they'll lie. So you can't automatically go by that. You hope that people do the right thing, but it's not a guarantee of anything.
Great point. Thank you, George. Hey, Chris, from a data perspective, what I'm trying to do is see, at least from, let me see, Doug is still on. Sherry, are you still on? I wanted to talk.
I am still on.
Okay, I wanted to talk specifically about data. Doug, I'll start with you, and then Sherry, I'll move with you. I'll move to you. Are there specific data sets or information you guys need right now? I know this is a moving target, but are there specific types of information or data you need to know about and track from the food perspective, as either state industry data, state data, or federal data? Doug, any comments from your perspective at this moment?
Tom, with many things still being decided locally, any state waivers or proclamations or containments or quarantines that are communicated, those are pretty important that we hear about those as quickly as possible. So I would say that's a pretty significant data point. Just because it's sort of hard to collect all those when they're coming from state to state. So that would be maybe the highest priority that I would say we would have. The other thing that I think would be really good from a transportation standpoint is I know it's challenging, but to the extent that we can actually start identifying on the map, like y'all did with Pennsylvania, which rest stops are open, truck stops are open. If states were only going to open so many of them and not open all of them, that we at least get that on a map so somebody can locate those pretty quickly, and then they could route their trucks.
Great point. My question there, are most of those along the major interstate? Anybody know?
Yeah. Well, yeah, I would say, major trucking routes. Then once they get into towns and they get into communities and start working their way through rural areas, then we start having other issues like we've already sent an email over to the National Restaurant Association about drive-throughs. So I'm hoping to be able to get on the phone with them today and start getting messaging out as quickly as possible. But then you run into that type of issue once you get into more rural areas where they get off the main interstates.
I know, Doug, that would be a big one. If you find something out, let me know. I know walking up to a drive-through is untraditional, but we're in untraditional times, and I think that would make a big problem go away quickly.
Absolutely.
So keep us posted. I think that would be great. So state declarations, waivers, curfews. Great. So just let me summarize, Doug. State declarations, waivers, curfews, quarantines, and restrictions.
Yep.
I want to, again, put a plug in for Healthcare Ready. They are tracking stuff we normally never track, right? They have curfew information, health declarations. The reason I bring that up, and Melanie, you can expound on this, I think where we're headed is eventually we're going to see quarantines or shutdowns, curfews, whatever, which is going to impact deliveries of everything. And, again, it's the same thing. The government issues an edict. People interpret it for a certain thing, and it has consequences. Melanie, any comments from your perspective on at least the curfew component? Where do you see that going?
Yeah, so we're certainly tracking that right now. Most of the curfews we've seen have been at the county or city level, but we are starting to see a few at the state level. As of right now, there are multiple sectors that have been deemed essential or critical, and they are excluded from these curfews and these orders to close business. So things like healthcare and public health are considered essential, and they're excluded from these orders. So we're tracking these issues to see how they can affect other sectors. But as of right now, everything is stable on things that are considered critical so that they can continue their operations, so that people can continue to receive the services that they need. So if you have any questions about that, you can feel free to email alerts@healthcareready.org. We'd be happy to forward resources on that as they're made available.
Alerts I'm going to put it in the chat box here, at Healthcare Ready?
Yes, alerts@healthcareready.org.
Ready.org. Yeah, I just really appreciate what you guys are doing. There's a lot of energy, and it ain't over. I think we're just getting started. So great work. You all need to understand what these folks do and how to become part of their organizations if you're interested in this, because it's doing a great work. Doug, any other data sets before moving on? You mentioned rest stops open and closed. Probably same with roads. I don't think we're going to get there yet, but any data sets you need? How about ports?
I think, roads, assuming, I don't think we'll get to that point where they start shutting roads down, but that would be one that would be extremely important if any of that started happening.
Okay. And ports, like maritime ports, same?
Yes, ports, major ports. Houston shut down yesterday, so that would be important. There's not that there's a lot of containers on the water right now, but there are some, so that would be nice to know.
Okay, very good. Sherry, how about from the fuel sector?
Doug said exactly what I was going to say. So he hit every point, literally. And Doug, if you'd like us to help weigh in with the Restaurant Association, I'm happy to, if that's in any way helpful.
Absolutely, Sherry. I'll definitely bring you into the conversation.
Thank you.
Okay.
And Tom, is it okay to bring up one other small issue here?
Absolutely. Yeah, absolutely.
Okay.
Sure. Go ahead.
So, PMAA did provide a lot of input for the essential infrastructure workers document that SISE put out yesterday. But we weren't specific enough regarding convenience stores. Retail is listed under restaurants that are essential, but it doesn't say convenience stores specifically. And I'm wondering if anyone on the call could clarify whether the term retail covers C-stores in the minds of the government, or do we need to ask to have that specified?
DHS, Greg, any comments? Chuck?
This is Greg. I'm not sure. Go ahead, Chuck.
No, it's all right. Sorry.
Would it be okay if I added something to that Houston closing?
Yeah, stand by 1 second. We just want to bring closure on the C-store question. Greg, there was
if I read the line?
There was an
email the line that I'm referencing.
Actually, Greg, what is the email? There's an email in the guidance. And this, Sherry, I would send an email to that email. It was in the guidance document.
Okay, will do. Okay.
CISA.stat. Anyway, because just so everybody knows, that document is guidance. It is not a rite of passage. Please remember that. This does not get you in. I can see people pulling up to a policeman someday and pulling out a 7-page guidance document
and he's going to tell them, yeah, forget it. Okay, that is not, and DHS didn't mean it to be that, right? They're trying to start the ball rolling. This is Rev 1. I'm sure there'll be Rev 2, 3, 4. Many of the states that we work with had not seen that. Now, when I say states, I'm talking about individuals within a state. So this is getting the conversation started, but because it's a big issue. It's a big issue. Essential workers being able to reach their places is big. And not every state has an access reentry program that's really, really good functionally or have one at all. So anyway, I wanted to throw that out there. I applaud DHS for making the move because the private sector needs it. But again, it's always the coordination at the state level is always the key. Back to the Houston closure. Go ahead.
The Maritime Port of Houston. My son is currently working there as we speak. He graduated from Maine Maritime. He now works on tugboats pushing in barges. I just spoke with him by phone, and he said that only the container terminals are closed at this point. Someone tested positive, so there's about 20 different terminals that handle containers, but everything else is busy and everything else is moving.
Wow, nice clarification.
Yep, I was lucky to get a hold of him. He's working as we speak.
All right, so what would we call that? That's kind of a partial closure, not a closure.
Yes.
Right.
Absolutely partial. The rest of everything else is coming in full steam. He says it's absolutely all hands on deck busy. He doesn't understand why it's so busy, but the port's full and there's plenty of ships anchored offshore.
Okay. No, that kind of clarification is really key, right? That drops the fear level dramatically. So
yeah, that's eyes on the ground, so we're good.
Yeah, perfect. I'm sorry, who's that talking?
My name is Matt Morris, and I'm with Maine Energy Marketing Association.
Hey, Matt. Thank you for that update.
Not a problem.
Congrats to your son, by the way.
Yeah. Thanks a lot.
He's now an authoritative. He's an authoritative data source now.
I'm gonna have to buy him a beer next time I go down to Houston.
Yeah, you tell him the SISE working group says thank you. Okay, we'll catch up with him later.
Will do.
Any other data sets from food or fuel sectors? Okay. Greg, from DHS, are there data sets you all need from private sector?
We'll take whatever data and information we can get. Obviously, it's just a matter of how do we receive that, whether it's through the SISE or through the GeoCollaborate type tool. So, we just need to have eyes on it. We want to definitely set up so it's that repeatable type process, but this might be an opportunity to really kind of push whatever information and data that we're getting. So, specific to food, fuel, a lot of discussions that we've had now, I'm sure are happening at our watch operations level now. I don't have eyes and ears on some of that right now, so I'm not sitting in the watch operation. So it's kind of difficult for me to say specifics of what we need. Unless Chuck, have you heard anything from your end?
Yeah, so a lot of the data sets that we receive from across the 16 sectors of critical infrastructure come directly from the sector-specific agencies. So, for example, DHS, SISE, we are the sector-specific agency for 6 of those sectors. And we also pull from the information collection centers, if you will, and those SSAs from transportation to Department of Energy, et cetera. So we do pull from all of those sources. Specifically for food and ag, I don't exactly recall where we're pulling a lot of that information from, but I believe it's USDA. And all of that gets rolled up by the analysts into some of the daily assessment briefs that are provided.
Very good.
Hey, Greg, this is Dave Jones. Just a quick question. Would you have interest in something like what Pennsylvania issued of their open rest stops that have portable toilets, things like that for truckers? Is that a piece of information that could be valuable?
Dave, yes. Any information that can we can leverage just so we have eyes on it. These questions and things of requests do come out, and we're getting a lot more more than we've ever gotten in any past type event. We've actually set up a RFI, request for information cell, to handle a lot of those questions and concerns coming in, even requests for assistance. So yes, those are very key.
Okay, Tom. Then we'll just coordinate on getting some of those data sets into 1, 2, 3, or 4 SO and turning them on for so you can turn them on for DHS.
You guys will have to figure out where to find them. I don't know, but that's something for the SISE work group to work with. Electric sector, any data sets that you guys need to monitor outside of what we've already talked about? Mark Sikorsky, comments?
No comments at this time.
Okay. George, listen.
And y'all may have spoken to it before I joined, but the only thing I could think of is if there were geographical quarantines put in place, entire regions, neighborhoods, areas, or whatever.
So quarantine areas.
Yes.
Okay. George, you hit on the big one I think that's coming. So we're not there yet, but I have a funny feeling talking with states that is going to happen somewhere in the country. Maybe in, but I appreciate you bringing that up.
Tom, with California, what they've done to basically stay at home, would that be considered quarantine, or is what is being mentioned here much more locked down than that?
In talking with the states, a quarantine isn't the same as a curfew, as I understand it. A curfew is a curfew, which means nobody out between these hours. And I don't know the answer, John. I'm just guessing. There might be two differences, but clearly the states and cities are going to have that data. Chris McIntosh, it's a great question. Chris McIntosh, have you heard anything on the big cities from the Big Cities Association about what they're thinking or possible data for this? I think George brings up a really good point.
Well, big one that they're looking at is gathering restrictions, kind of to John Molnar's question. And we're tracking that, which cities are implementing which level of that. It ranges from complete to still there's a few places that are 1,000 or more. So that's a big data set. And then government status is the other thing that's really big on that, how are government services shutting down, and that's variable all over the place, from complete shutdowns to staff only to teleworking to liberal leave. And so those are primarily the things that they're focused on. They are concerned about downstream impacts on supply chain, Doug. So those questions are being asked, and then, frankly, I don't know that they're getting the answers that they're looking for. So that's just kind of those top three seem to be bubbling up repeatedly.
Okay.
And Tom, one of the things that this is Dave Jones. One of the things that we're talking to within the state of Florida is a group that are starting up mobile testing facilities. They have medical mobile facilities, and they may be able to drive around the state of Florida in these mobile. They have 6 or 7 of them. So that might be popping up too, the location of these mobile testing facilities or where people can get tested.
Okay, very good.
So, Tom, what I was referring to is California's governor ordered Californians to stay at home, marking the first mandatory restriction placed on the lives of all 40 million residents. The governor's action, where they basically only continue to visit gas stations, very specific areas that they're allowed to leave their homes. Is this what we're talking about, or are we talking even more than this?
I guess I would throw that out to the private sector. That is a don't leave your house. That isn't no businesses are allowed in, meaning like yellow tape is up, right?
That's correct. It still allows the essential sectors to be able to continue to do what they need to do to serve the public.
Doug, is there a word for that kind of walling off? I mean, I don't know if there's an official word for it or not. Quarantine or restricted area, or
they've been using them, and I don't know if they've been using them interchangeably, but they're trying to decipher. So, shelter in place, which one we're used to, quarantine, containment. I think they're trying to use shelter in place to the extent that they possibly can, because it sort of covers everybody, whether you have the illness or not. Where quarantine is that you're doing it for a medical reason. And then obviously we've seen what containments, and containments haven't worked. People were actually leaving New Rochelle rather than staying in the containment area. So,
yeah, I think John's asking a good question. I guess is there a word for business can't deliver in this area? I don't know if there is one, but
Tom, this is George,
yeah.
And that's kind of what I was getting at, that in our footprint, of course, the city of Houston, but there's dozens, many dozens, if not hundreds of other communities that have municipal jurisdiction. And if they say we're not letting anyone in, or if the state or health groups quarantine specific areas, I know that one of the issues that we're dealing with right now is in our process is that they've set up mobile testing sites, or setting up testing sites, and large, in our staging sites, basically the staging sites that we have for mutual assistance events, they're taking over stadiums and stuff like that for those. And so now we're looking, if we do get hit with a mutual assistance type event, our staging sites have already been commandeered by the city of Houston. So things like that.
Yes. Okay. I'm going to circle back to our state liaison committee. I know all of them are heads down this morning, but that is something we're going to work closely with them on. So stay tuned. I'm sure all the states are working on the next steps, like what's going to happen a week out from now. So stay tuned. I was hoping we could have 3 or 4 of them on this morning, but they're all tied up in status calls, which is fine. Okay. Any other data? Let me open up to the group. Any other data needs that we as a GIS group ought to be focusing on? Not that these are enough. These are plenty, but are there anything else we want to look at that we need to know now, or what we will need to know in a week?
So this morning I went ahead and sent the DHS guidance again, or advisory type guidance again, and also what we had worked on with InfraGard, the National Disaster Resilience Council. So you can sort of look through those if you'd like. I do have another document with what we considered information gaps. You may add that to your list too, Tom, if you want, for future meetings where you get a bunch of folks together and maybe answer some things.
Fred, may I share this? Can I share this document with the group?
Yes, you can share those.
Okay. It's up on the screen, and they're looking at the cascading impacts of COVID. It covers pretty much every sector. Communications, critical manufacturing. I'll share this out. It's a great document, Fred. Thank you for sharing that with us.
Yeah, we tried to get our sector chiefs and also those who contributed to some of the books and things that we put out, tried to tap their knowledge base. If you can think of something you want to add to it, just provide my email address, or I think my email address is at the end of it. Go ahead and get a hold of me and we can add to it, just make it better. We want to share it widely and give everyone the opportunity to sort of think through what's going to happen in the coming weeks or months, or the what ifs.
Yeah, okay. Very good. I know we're coming up on the hour. Good start here. The question I have is, does the work group want to continue this, working the issues? Hopefully we can get a couple of states to chime in next Friday. Let me ask the private sector. Doug Baker, you're good we can reconvene next Friday? We just had to hang up here. Electric sector. Okay, get text here. All right, good. So what we'll do is we'll try to circle back and see if we have any progress on this, on the data side, as well as the definition of what we're looking at for containment areas, because there's going to be several levels of that as well. So, Carrie Hicks, are you on? Okay.
Hey, Tom. Yes.
Oh, I didn't see your name at all on the GoToWebinar thing. Sorry.
It's all good. What's up?
Carrie, I wanted to ask you about data. Have you chime in on, I don't know if you heard the discussion on the data needs at the moment.
Could I get a kind of a recap on that? Sorry, I had to jump off from 10 to 10:30.
It's okay. Current data needs, Carrie is chair of our GIS committee. I wanted to make sure before we hung up I got a chance to hear from Carrie. So state declarations, waiver, curfew, quarantine areas, restrictions, so forth. Rest stops along the interstates that are open. Status of maritime ports and roads. George Eason from, I'm reading to state, okay, state and local quarantine geographic areas, if and when we get to that, and then state restricted areas where nothing's allowed in or out. I don't know if we're there yet, but we need to plan for that. So are we trying to think, is there any other data needs from your perspective, from Duke, that we need to be planning on or maybe looking for?
Not at this time. I mean, the main thing that we're looking at is travel restrictions. So you mentioned that already, and that's kind of at the top of our priority list.
When you say travel restrictions, Carrie, you're talking about declarations and waivers, curfews, things like that?
Correct, yeah.
Okay. 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 Before we drop, I put a bunch of links in the chat area. Feel free to copy those. They were some of the information shared today as far as data. Okay. I also put the link in there for Healthcare Ready. They are tracking the health declaration, state and federal. A lot of information that we haven't tracked, but they put a lot of effort into this, and it's really, I'm sure that website's getting pounded. We sent it out to our stakeholders early on, so we're really happy to have them doing the work. So Melanie, please pass that on to the group there at Healthcare Ready. We'll continue to monitor this as as the thing unfolds, and we'll circle back with our states and see if we can come to some product or data or definition we can get around some of the questions the sector had on today's call. Okay.
Hey, Tom.
So yeah.
It's a quick question. As you get state declarations and waivers, will you be putting them onto the site so we can link to them and distribute them through the FRWG dashboard?
I'll get them and send them to whoever wants them. So yeah.
Okay.
Now,
sounds great.
Right now, there's no way we will catch up, Dave. So we can pull them from there, and we're helping them get waivers. We sent out notes yesterday to a lot of our states about travel waivers. Got one back from DC. They'll trickle in as we go. So I think it's going to be a catch can effort for now, right? As we ramp up, hope to have it ready to go. So
sure, no worries.
Okay. Okay, good. Any other comments before we go? Okay, as I said, we'll circle back with the states next week. Hopefully, we can have some data sets or potential angle on how we can get some data sets to work on these data needs. So Carrie, any comments before we drop?
Not me. Thank you. Sorry.
Carrie, thanks. Sherry and Carrie. So, Sherry, any comments from Fuel?
No, I've covered everything. Thank you.
Okay, well, I hope this is productive. We're kind of feeling our way through it, but I know once we get a lead on a solution, we can dog it down pretty quick. So I think we got a couple. Any comments from Electric? Any comments from Communications? Okay. Very good. From DHS?
Hey, Tom, this is Greg. Just a quick comment. As we kind of identify what the data needs, just keep in mind if we can kind of tack a level of data confidence on some of these, and from how often the data feeds are coming in, more detail on specific information. It just helps in our reporting and identifying what that data confidence is and making recommendations moving forward. So, thank you.
So, Greg, you brought up a question: is how do we ORL rank the CDC and Johns Hopkins websites? Anybody have any thoughts?
Well, CDC is an ORL 1. Johns Hopkins a little more. I would make it a 2 or a 3 but we have to know. The one thing that concerns me in Johns Hopkins is that they do rely on media as a component of their data. And I think that drives the ORL ranking down, but I'm not 100% sure how that would work with the ORL algorithm.
Okay. Very good. All right, very good. All right, well, listen, folks, we're up on the hour. Thank you all for taking the time. We've got a lot of issues to address next week. Hopefully I can circle back with a few of you on some data, and we get our states to chime in on a couple of these issues as well. So if you're traveling, please be safe. We thank you all for joining. This will conclude our call for today. Have a great weekend.
Thank you, Tom.
Thank you.
Thanks, everyone.
Thanks, Tom.
Thank you.